Hey everybody, thought I should probably do a little video update. First of all, I just want to say hi to all of my new subscribers. Thank you for subscribing to me, and I really appreciate it. It's really exciting when I get a new email. It's like, so-and-so subscribed to you. So thank you for joining me on this journey. And of course, thank you to everyone who continues to join me on this journey. So thank you very much. Let's see. So I got my first pharmacology test grade back, and I did not get a passing score. I wound up with a 69, which was actually what I pretty much thought I was going to get. Like, I knew I wasn't going to pass. I just knew it. But I think, and combined with my previous quiz grade, I'm like 2.5 points away from a passing score in the class. So I think what that test taught me was how to organize my information better, how I should be studying. Like if you're looking at phenytoin, you want to look at its side effects, its adverse reactions, what you would use the medication for. It treats this, but it also treats this. You just kind of have to organize it in that way. Just kind of try and keep remembering. What else? So yeah, so I know I can do better. I have 2 more tests and the final. So I know I can bring it up. I know, and I know I have I know I can do it, and I know how I can do it. So it's just doing it. It's just getting myself organized and getting my stuff together. Someone asked me, I think it was Medicist Vera. She asked me what pharmacology book that we use, and it's this one. You can see it. There we go. Pharmacology, a Nursing Process Approach by Keyes, Hayes, and McQueeston, the 7th edition there. As you can see, very, very thick. And then it also came with this study guide, and there's like all kinds of questions and things just to help you study. It's actually not a bad book. It's by Salvier and Saunders. And then, of course, you get all the online stuff with Evolve. So it's not a bad book. Apparently, the 6th edition on Amazon, I think I've mentioned this before, had a lot of mistakes. But this one seems to be okay. They're, compared to the 6th edition, since my class, half of us has the 6th edition, half of us has the 7th edition because of the bookstore. Some things have changed. Some things are, reorganized. In the chapter we were going over antibiotics, there was a part about MRSA, M-R-S-A, and antibiotic-resistant infections. There was an extra paragraph about that specifically in my 7th edition, but not in my classmate who was sitting next to me, not in her 6th edition. So I guess, information gets updated, obviously, because medicine always changes. So that's what we're using, and who knows what that 8th edition will hold. But this is a good book. I like it. I don't know what else to say about that. Oh, and I also got, I think it's over here. Hold on. I bought this here, the Nurse's Med Deck. It's by Unbound Medicine, Davis Plus. It's kind of combined with the Davis's Drug Guide for Nurses. And it's really neat. It's filled with cards, and I like the way that they're organized. It comes with a CD for your computer, and you also get a bonus. You get the drug guide. You can use it on your computer. That's a bonus. And then you can also download the app through Unbound Medicine with the Davis's Drug Guide, which is really neat. You get that for a year. And then I was looking through these, and it comes with a plastic pouch, so you can put up to 30 cards in there and just take them with you. What else? What else? This deck is pretty cool, and I got it for about 25 bucks because I had a coupon at Borders. I think it was a 30 or 40% off coupon, and I wanted to make sure to use it. Comes with, let's see, comprehensive index. And then this is really cool. It gives you these yellow cards in the very beginning. It gives you the specific class of drugs, like anti-diabetics, and then it gives you pharmacological profile, contraindications, precautions, interactions, nursing implications, you know. It gives you all kinds of information. And then the drug cards specifically are really neat. They're very detailed. Let's see if I can find one. An easy one. Here's one. Acarbose. And it gives you all the specific information, classification, indications, action, pharmacokinetics, contraindications, adverse reactions, side effects, all of that stuff, nursing implications. So this is a really patient and family teaching. And then what's cool is that it asks you at the end of the card, why was this drug prescribed to your patient? Because, you know, your patient might be taking Flagyl for a UTI or to prevent an infection in their BKA stump. So you want to know why your patient specifically is taking that particular drug, because it might be one thing, it could be another thing, you don't know. So that is one thing that you have to know in clinical. So I really like this Nurse Med deck. I'm really glad I got it. It was between this and the MediQuick cards, but I'm glad I went with this one in particular. What else is going on? Not much is going on. Just getting more and more excited about the wedding. I know my bridal shower is about a month away now, and then the wedding's another month after that. So it's very distracting from studying, which is a huge problem, and I'm trying to get back on track with the studying. But it's difficult when you have other things you want to do, even though they keep telling us for the next few years your life is ours at school. Oh, speaking of school, we finally got a lottery date, so we'll finally be able to pick our classes, and I'm very excited about that because I'll be able to know, you know, if I'm taking OB first or Med-Surg 2 first, and then I hope to be able to get a CNA job. Maybe not at the beginning of the year, but maybe in the summer, so we'll just see how in need of a job I am. Because I was hoping to just take off work that third semester and try and get a job in the summer. But we'll see how that goes. But yeah, I'm really excited to finally have that date, and so we'll find out on Wednesday what our new classes are, and that's about it. That's the most exciting thing going on besides the wedding. I signed up for a boot camp class. Blah. I got a Groupon for 5 weeks at this Michigan Women's Boot Camp place. And then you get a free trial week before that, so it's really 6 weeks to get me in shape for the wedding. So they're probably going to kick my butt. Like, I'm a runner, but if you stuck me on, like, the Biggest Loser camp, I'd probably be throwing up faster than those contestants would. But, yeah, so it's going to kick my ass. It's probably what I need, a good kick in the butt, to get back on track with eating right and exercising regularly. Because getting to the gym is a pain, too. But I figure if I'm paying specifically for this, and if I get in half the battle is just getting started. Like, even with studying, like, I like studying, but half the battle is opening the book and beginning to study. Like, half the battle in running is putting your shoes on and heading out the door. So I'm actually going to go read now. See, I got my book next to me now. I'm going to read about some antibiotics and maybe some HIV. And that's it. So if you guys have any questions or comments or anything you want me to talk about, let me know. Hope everyone's doing well and studying hard. And feel free to give me a virtual slap on the hand for not doing so well. But I'm going to get it back, I swear. I swear, because I can't do that remediation thing again, because they already don't like me for doing it the first time. So I'm going to get on track, and I'll see you guys next time. Bye!